Okay, this is the PowerPoint I have created for EDU 652. I chose the topic success working as a certified nursing assistant in a nursing home setting because I am a nursing assistant and I know what it takes and what all we go through in the nursing home setting. We want it to be as successful as possible when in working in the nursing home because it's a lot that goes on and it can be a hard job. Some of the stuff that we know about working in a nursing home is that working in a nursing home can be a strenuous job, and that working in the nursing home requires skill, good ethics, and good morals. If we didn't have skill, we wouldn't be able to work in a nursing home. Good ethics and good morals follows working in the nursing home setting. I mean, we come in contact with a lot of different patients, and none of them are exactly the same. Some of them better than others. Some of them, sometimes we get a good group, sometimes you get other groups. But this, some of the things that we know about working in a nursing home. We also know that when residents are admitted to a nursing home, they usually find the nursing home the last home they will see prior to leaving the temporary world, well, prior to dying. And we want to make this the best experience possible. We want their families to understand that, hey, your mom, your dad, your grandmother, whoever they may be, is in good hands. You can leave them and, you don't have anything to worry about. We want to be viewed as the best. Some of the duties of a certified nursing assistant is that we certified nursing assistants are frontline staff members who routinely feed residents, provide the majority of residents' social interaction throughout the day. CNAs frequently feed many residents per meal, and they can feel a tremendous amount of time and pressure to complete the task. This is so true. And sometimes the resident may eat a little slower than usual. We just report it to our nurse. And hey, we must keep going. Regardless what else is going on, those residents have to eat and they have to be tended to. All of the needs of the resident must be met. And this is something I've cited from a ProQuest article in the Ashford Library. This is just saying, okay, this is another way of we can be a success in the nursing home setting. When nursing assistants create a bond with the resident that makes them feel secure in the nursing facility, appears to be more of a home to the residents. If the resident feels he or she can't trust the nursing assistant or either any other staff member, I should have put, they might decide to go to another facility. When working in a nursing home, we always want our facility to be viewed as number one by all visitors, staff, and residents. That makes the overall building a great success. And we want to know how to keep up our success within the setting which we work. Okay, these are some of the things that we want to do. This is some of the stuff we want to know. We want to know how to provide a loving environment in a nursing home setting, how to be stress-free in the nursing home, how to successfully complete the job duties in the nursing home. To answer the first question, providing a loving environment takes compassion. It takes a lot of compassion. We must love these residents, regardless what's going on. You have to be, I want to say you have to be a people person to work with residents, because we deal with residents, as I mentioned, of all kinds. It's kind of hard to be stress-free in a nursing home setting, but you must always expect the unexpected. Always expect the unexpected. Nothing is never perfect, but it always works. And it's a lot of people to help you when you're a team. We have a team, a great team at the nursing home which I work. Okay, successfully completing the job duties in the nursing home, it requires us to use our time wisely. We can't be goofing off on the job in a nursing home because, hey, we have work to do. We have a lot of work to do. We have to tend to these little old ladies and these little men, and it is very important that we meet all of their needs. Good communication, that's very important in the nursing home setting. It can make it very, you can make you very successful having good communication skills. A wonderful relationship. I wrote at the bottom of this, it says, good communication skills are a start to a wonderful relationship with the resident. Even though at times narcissists may have to delve deeper into their morals to promote positive feedback, when the sender, and I put in parentheses or whatever, that the resident may be negative, then we might have to kind of change up a little bit. We might have to. Sometimes we let them go and just come back to them and they'll forget, because we dealing with all kind of residents. Let's not remember these residents are not physically, emotionally, and mentally stable, which means frustration has set in. And there you see a photo of a sender and a receiver. And it's good that the sending end and the receiver end matches. We want it to mate up. And even if you have to just get on their level for a second, that's fine. But never the negative level in order to be successful in the nursing home. Okay. Determination to become a successful nursing assistant. This is something we are determined. This is something we're trying to determine. Okay, if we follow every learned procedure and use good morals and ethics when coming up to conclusion in reference to patient care, that we shouldn't have a problem. If you know your stuff, we all were trained. All nursing assistants were trained. The nurses were trained. Most of the staff members have been trained, except outside of housekeeping or whatnot, to tend to patients. And we use good judgment. Use good judgment when dealing with the patients, because they're very frail and fragile. You see a photo there of a lady assisting the elderly guy to the bathroom or whatnot. And this is some of the stuff that we do throughout the day. In order to be successful in helping that guy to the bathroom or wherever he might be going, then it's important that we learn every procedure and follow every procedure. Working in a nursing home, this is the biggest thing that working in a nursing home requires. We must love. We must love all those residents. And I tell you, I love all of mine. I've been doing it for 13, I'm thinking right at 13 years. And I wrote underneath there, working in the nursing home field requires one to demonstrate a profound sense of love. Certified nursing assistants perform more hands-on tasks than that of any other staff member working in a nursing home. And that is very true. It seems like a load, but at the end of the day, we did something to help the resident. And when you can see that the resident, and they can't wait till you get in, or they're waiting on you to come to work, and I have a lot like that, then hey, you are a success in the nursing home. I found this quote also in the ProQuest library. Being a nursing assistant is not just a job and a paycheck. It's a beautiful and wonderful life of kindness, honesty, courtesy, fairness, pity, help, trust, and forgiveness. And I find this to be very true. We can't just be paycheck to paycheck working in a nursing home as a nursing assistant, because if we just working for a paycheck, hey, if we working for a paycheck and we don't like the job, it just doesn't add. It doesn't balance out. It doesn't balance out. I tell you, I love my job. I go in. I have a little lady I sit with. One of my I'm off 2. I work 4 on 2 off, and I sit with her one day, and the other day I just go up there and check on her just because I love her. She's a 102-year-old little lady, and she's always looking for Janie, even though my name is Jamie. But this is just, it's important to be honest and not just think about a paycheck when working in a nursing home. Okay. And those are my references. And that was my first recording. And I hope you all enjoyed.